All right, let's talk COVID-19 in Connecticut once again with Dr. Syed Hussain from Trinity Health of New England. Good morning to you, sir.
Morning. Thank you for having me.
Glad to have you here right now. I want to start just by talking about the pandemic in general. I think at no other point in the pandemic was I not sure exactly what to make of where we are right now. I think a lot of people thought we're not going to be dealing with rises in cases at this point, mid-spring in 2022, and yet COVID's everywhere. At the same time, deaths are still low and don't really appear to be rising much, which is what the goal was all along. I just don't know how to make sense of where we are. Does that make sense?
Yeah, Tim, this is expected because we're moving towards an endemic phase, which means this virus will continue to remain in our communities. It will smolder. We will continue to see outbreaks like we are now experiencing. What's really good, though, is the virus has mutated to an extent where it's causing less severe disease. Those people that are higher risk of developing severe COVID-19 still need to take precautions. But overall, though, I think we're moving towards that endemic phase where we will have to coexist with this virus.
It sounds like, though, just like with influenza, we're at a point where we would never really be out of the woods in terms of the risk of it mutating in a way that it might come back and evade our immunity because it seems to be mutating faster than ever.
So what's promising is over the last couple of years since we've rolled out the vaccines still have been very, very effective against all subvariants in terms of preventing severe disease, hospitalization, and death. Are they as good in preventing symptomatic infection? Probably not so much. But in terms of severe outcomes, they're still holding strong.
Okay. Just within the past week, it looks like the ball is now rolling faster than ever on vaccines for the 6-month to 5-year-old age group. Where do we stand with that?
Yeah, so Pfizer just submitted additional data. They will to the FDA. 3-dose vaccine seems to confer a high degree of protection in those that are below the age of 5. There are about 18 million children in the U.S. that fall in that category. Yeah. And Moderna has also submitted data on a 2-dose vaccine series for children. We expect the FDA to review data by early next month.
Okay. Monkeypox. We learned about that within the last week and a half. Tough to sort of contextualize the reporting here. Obviously, case numbers are very low. What do we know about this? It's not new. That's the first thing I think we need to tell people.
That's right. And I want to tell viewers, please don't panic. This is not COVID.
Yeah.
We're not going in for worldwide lockdowns. This is a virus that we know a lot about. We have vaccines and we have antiviral treatments that are available for use. Yes. The symptoms, just so folks are aware, include fever, lymph nodes that are swollen, followed by a rash. And right now, it's about 12 countries or more that have reported an outbreak of monkeypox.
A last quick question. My understanding is that there's a number of ways it can transfer, but it generally requires a sustained amount of contact for a while with an infected
That's
person.
right. 3 important modes of transmission. First is prolonged skin-to-skin contact. The other is using infected bedding or clothing of an individual if you come into contact with that, or respiratory droplets. So close contact is the key here.
Close contact, which is not always what COVID needs to spread as well. That's another reason why this is not COVID. Doctor, thank you. We got a lot in a short amount of time.
Thank you very much.
Good to see you again, sir.
Thank
Dr.
you.
Syed Hussain from Trinity Health of New England has been joining us on Tuesdays now. Really appreciate the info. Okay, over to